Welcome to Penrose Learning, where we make understanding easy.
You begin with the essentials. Power on the machine and verify the humidifier has water so therapy starts immediately. Once done, inspect the cushion for wear because leaks reduce effectiveness and cause skin issues. Make sure to sit upright, position the cushion gently against your nose and mouth, and then attach the headgear loosely. You'll feel the initial seal, don't over-tighten yet. This step establishes a baseline fit and prevents pressure points when you adjust straps later. Now continue by connecting the tube to the mask and machine. Secure clicks mean no leaks at the join and avoid sharp bends that reduce flow. Once connected, tighten the top strap first to stabilize the mask, then adjust the lower straps little by little so tension is even. This preserves the seal without pinching. After that, turn on therapy, breathe normally, and scan for leaks. If you feel air on your cheeks or hear whistling, slightly loosen and recenter the cushion. Finish by lying back in your usual sleeping position and wearing the mask for 5 to 10 minutes to confirm comfort and seal under real conditions. Make sure to follow a cleaning routine. Quick daily wipes and a weekly soak prevent buildup that breaks seals. If you still have persistent leaks or sore spots, try a different cushion size or rotate the mask slightly. Changing angle often restores the seal. If problems continue, contact your provider for a mask refit. That usually fixes stubborn leaks.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.